Hey, what's going on, everyone? Wanted to do a quick little discussion about a topic that I remember hearing about several years ago when I was starting to get into spinal corrective care, and they were reviewing the statistics that were reported like in the different physical therapy journals as far as the compliance of patients with prescribed home care, how low it was, and how no one could figure out how to overcome this, and you just had to accept that literally 20% of your patients, when you prescribe home care, are actually going to do it. And so that was kind of daunting to me as I'm sitting here learning about spinal correction, learning about curve correction. And now granted, this transitions further into the story as I got more into mobility. We started MoveWell University, which now we've rebranded as Move Now. So if you see Move Now, Move Well, please don't be confused with that. We're switching things over slowly. So anyway, I'm sitting here in these seminars, I'm hearing about how there's such a low percentage of patient compliance with home care, but yet home care was so important to be able to get a patient to actually make the changes that we're shooting for in their structured care plan. And everyone just kind of threw their arms up in the air. They didn't know what to do about it. And it was just this thing that you had to accept. And I'm sitting there thinking, they're not touching on the why. They're not giving incentives to the patient. They're not providing enough resources. They're not automating the process. They're not making it just easy enough for the patient to follow it, be able to see progress along the way, have them get internally motivated. Like all these variables were not happening, but instead what would happen is, hey, I showed you a couple of exercises. Here's a black and white piece of paper of some stick figure drawings that's been photocopied 20,000 times. Go ahead and do that. And so of course the patient's like, okay, I'll do this once and I'm never gonna do it again. And so now on the flip side, like in our practice, we routinely prescribe for our patients to do their home care anywhere between 5 to 11 times per week, depending on a severity grading that we give them, and it's color coded as well. It goes red, orange, yellow, green, as far as how severe they are and how many times they should be doing their home care. 5 times, 7 times, 9 times, or 11 times per week. And then we have these vehicles in place for patients to track what they're doing. We have resources for them to look to. So anyway, the whole topic of this here, I'm gonna flip the camera around. I'm gonna flip the camera so you can see what I did on this dry erase board. Okay, so move this a little closer. So the whole point of this is that I want to discuss why home care doesn't work, at least for other people, but why it certainly does work. Here, bear with me, I'm changing this camera angle. But why it does work if you do it the right way, and if, in my opinion, you include the right variables. So I just touched on some of those things as far as how to motivate a patient, how to give them resources. So first off, here's why home care doesn't work. I just covered some of them. Home care doesn't work if you expect a patient to do it and you give them like a black and white drawing of some exercises to do. They might stick with it 2 or 3 times, or if it's the rare exceptional patient, they might actually follow it to the T. But how do we beat these daunting stats out there of like 20% compliance with home care? Why would chiropractors even put the effort into it if only 20% or 10% of your patients are even going to do it? Is it just something you do so that you can say, well, I went through the motions and I explained to Mr. Jones, here's what he should be doing, and then I can use this against him in the future when he doesn't improve to say, well, are you doing your home care? That's not why I recommend a doctor out there doing home care for their patients. It's not as a fallback to say, here's why you didn't get better because you didn't do your home care. Instead, it's a real thing that we expect our patients to do so they can get exceptional results. Because what happens when a patient gets exceptional results? They do better, they feel better, they refer more, they make it to their appointments, they're just better patients across the board. And first and foremost, you're doing what you're supposed to do as a doctor, is you're getting them better. And how do they actually improve? It's with your guidance, you're coaching them, you're showing them what they need to be doing on a daily basis to get the results that they want. It's not just come in, I'm gonna be this passive patient, do these different things, adjust me and put ultrasound and E-stem and all these things on me, and I'm gonna magically get better. No, it's that to get better. It is an active process. And so from day one, that's where the culture in the clinic needs to start changing. If you want home care to work, the culture needs to change from passive to active. It needs to talk about, yes, there are things that we will do passively with you, to you. We will adjust you, very, very important, but that is a passive thing that we're doing. You lay there on the table and the doctor adjusts you, okay? That's passive. Active is you starting to learn corrective exercises, mobility drills, things that you're going to ingrain into your daily routine as almost routine as brushing your teeth. It's retraining you to do these things so you can actually get lifetime results. And so now, I just want to talk a little bit more about this, but first off, a side note, we just created a website that is movenowyou.com, and I put a link above with a little /login. And if you're a chiropractor who's been following our stuff, or you're just stumbling upon it for the first time, you can go in there and you can create an account, and you have to put in your chiropractic license and all this sort of thing so that it sends an alert to us and we can approve it, so that this is only approved for chiropractors. The reason that we do this is because this is a public website. We have different tools and products and things that chiropractors get from us. They source from us as far as home care, and we want to keep the pricing to doctors exclusive to doctors and not to the general public. So it's not that we really even have the intention of ever selling it to the general public, it's just other people can stumble upon these sites. We want to keep the pricing, like I said, exclusive to chiropractors, so that's why we ask you to create your account. So go in there, create your account. We just launched the site. We have probably 30 or 40 doctors that have already jumped on board and created the account. We're looking to get several hundred doctors creating their account on there so that we can then show you when we're doing different specials and things. Like right now, we actually have a 4th of July special that I believe ends Monday. So jump on the site, you can see it. There's a little code that you can put in. What are the kind of things you can get with that? I'll just show you what our home care kit looks like. So it comes in a bag. There's protocols that come along with it. There's actually a whole program that we created called the MoveWell Home Mobility Kit Doctor Training. And that's something that you're gonna see a lot more about very soon, because we are putting some kind of like polishing touches on that program that we built, and we're gonna be relaunching that out again. Not that it ever went anywhere, it's just that I think a lot of chiropractors out there didn't realize that we have like a light version of how to put functional movement into your office. And how do you start doing that? With home care. So here's what the home mobility kits look like. You get a foam roller, all right, and it's all branded to MoveWell Spinal Rehab. Okay, so that's the first thing. And then there's 2 different mobility bands in here. So you have a red mobility band, and they all have little logos and stuff on it, so it's all branded. And we talk about this inside the training, the power of sub-branding, of actually using sub-branded stuff, okay? Sub-branded tools, not just something generic that you find off Amazon or your patients find on Amazon. And then a neck trigger point tool, double cross ball. And then the last thing on here is a J-cane. And so it's not that it's just a bunch of tools that you hand to your patient and they say, well, do I really need this? Can I get this somewhere else? It's that there is a movement assessment, there is an analysis based on movement assessment, there's a prescription of protocols, and the protocols utilize these tools. And then we built resources that your patients can use, and we built a little mini journal that your patients can use to basically track their progress at home once you prescribe what they should be doing. So essentially what this is we took the full-blown system that our MoveWell or MoveNow University doctors use in their practices. That's very robust, takes a little bit of time to put it all together and put all the pieces in place. We took a Cliff Notes version of that and we built out this whole mobility kit doctor training. So now that allows a doctor that says, look, I want to start something now. I know my patients need home care now. I already do a little bit of functional movement, or maybe I have no space in my clinic to do any functional movement, but I want to be able to do something now. What can I do? And that's why we built this whole little mini program called the MoveWell Doctor Home Mobility Kit, Doctor Training, something like that. Okay, so that's something I'll make sure I do in the comment section below as soon as I finish this training that we're talking about, or this discussion, is I'll put a link so that you can see what that whole thing looks like. So anyway, again, the reason that home care doesn't work is because it's lacking all the things that we made sure we covered in our Cliff Notes version program and in Move Now University, our full-blown program, which enables you to do all this stuff in office and at home, create a different culture in your clinic, and really make movement a main language or a main center of analysis and what you're talking to your patients about, how you're gauging progress. That's in Move Now University. That's the full, robust program. The Cliff Notes version is the one that centers around the home mobility kit. And what it includes that most home care systems don't have is a patient exercise library that they can access in a membership site. So they get a username and a password. It's written inside of this little just single fold cardstock deal that you print, which is a journal that patients can basically open up. There's check boxes. You check off what protocols they should be working on based on a movement assessment called the MoveWell Quick Check, which can take 5 to 7 minutes for either you or your staff to be able to take the patient through some very basic movements to say, yep, guilty, 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 faulty, 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 here's what you should do. And then what this also does is provides tools that the patient sees in these videos so they can see why they need these tools because they want to follow these protocols along at home. And you're giving them everything on a silver platter. And then that's something that you can use with your current patient base. So we teach a process of teaching workshops, whether it's weekly or twice a month. You gather up your patients to come into these workshops. You go through a presentation explaining why this is important. We share the presentation inside there as well. And then patients sign up to do a movement assessment. And when they do a movement assessment, you take them through it, you tell them where they're at, you grade them. I believe it's a 13-point scale is how we put it together, maybe a 12-point scale, don't quote me. It's been a little bit since we looked at this. We created it about a year ago. And anyway, then what happens is they do a movement assessment. They say, hey, I've been coming in once a month and I've seen you forever, but now I'm interested in actually setting some new goals and going through these protocols and improving my mobility and improving my posture and decreasing some of these nagging issues that I've kind of learned to live with and I thought were never going to go away. And you say, great, Mr. Jones, here's what we're going to do now. Instead of seeing you one time a month, we're going to take you through this process now. I'll see you weekly over the course of the next 12 weeks, and you're going to follow these protocols at home. We'll make sure that you're getting checked and adjusted throughout that process, because as you start to engage in more exercise and add more mobility drills and protocols into your daily routine, your spine is probably going to feel it a little bit more, and you're probably going to necessitate a little bit more frequent checkups and adjustments. And you can use your discretion based on your patient, but it can go from, instead of seeing them one time per month, you're seeing them weekly or maybe every couple of weeks throughout this process. You have objective comparable measures where you do a movement assessment in the beginning and you do one at the end, and they can see and they can feel their improvement, and they have to get a mobility kit from you as well to do these things at home. And we provide this for you. We provide the training for you. We have all of that stuff. Like I said, it's the light version of Move Now University. This is something that we launched pretty hard and heavy, like I said, about a year ago. And I was talking to Vlad, who does a lot of our support. And I said, Vlad, did you know that we already have this whole light version for doctors to implement? And he said, yeah, I'm kind of vaguely familiar with it. So over the last couple of days, I took him through it. I spent a couple of hours teaching him everything that we built inside there. And he said, Dr. Todd, this stuff is gold. Why are you not talking more about this right now? And I said, well, because you know how I am. I like to create content. I like to create programs. So we take the stuff that we do in practice, we share it, we create it, we put it out there, and then it's on to the next, and it's on to the next. And he said, you need to spend more time talking to doctors about what you already created, because this is so helpful for them. And he talks to so many doctors on the phone each week that he said, this is exactly what I think a lot of doctors need, as either that's as far as they want to go, and this is the way they can start to add functional movement into their practice, or at least home care, or this is the segue into them being able to do more and more and more, is start with the mobility kit program. And I said, all right, makes sense. So you're gonna see a lot more, you're gonna hear a lot more about this, but home care is one of the center just focuses of our practice. And it's made such a huge difference because patients can see and they understand from day one that we're gonna be measuring things as they go. We're gonna be providing resources, and we're gonna help hold them accountable and help motivate them to actually go through the process to do things at home by themselves for the rest of their lives. And they like that because what do most patients complain about when they went to a previous physical therapist or chiropractor or whomever? We heard this all the time. What is it? They say, well, I went in for a couple months, felt a little bit better, but they didn't really teach me anything, or I don't really do anything different long term, or now my problem came back. And I ask them, well, did they teach you a protocol or a program for you to continue every single day for the rest of your life? And they say no. And so now, real quick, how is this different than spinal exercises, like spinal hygiene exercises? This is a kind of a different angle. Yes, it crosses over, but this is taking different movement patterns that someone is faulty in, identifying them, and then teaching them these are the things that you should be working on a routine basis. For example, if someone can't bend over and touch their toes, why is that? They could have a tight posterior chain. They could have weak and inhibited core musculature, okay? So they could have muscles that are like beef jerky, that are taut and tender and maybe adaptively shortened from sitting for long periods of time and whatnot. And so now there's a process of getting them moving again. But if they're gonna have those same types of lifestyle situations, maybe they're sitting for prolonged periods, or they're just not using that range of motion, that's where we're gonna educate them. Here's what you do on a daily basis to unglue some of those tissues, to repattern those movements, to reinforce them with good functional movement, full body movements, and to ingrain this in the brain so that the motor control aspect is also firing on all cylinders. So anyway, that's a lot of the technical, tech babble that's inside of our doctor training. The stuff that us doctors love is all the tech stuff, right? But we also talk about, like I said, how to engage the patient, how to launch this out in your practice. And this is in the light version of Move Now University, which is the home mobility kit. So I'll put a link in here in just a minute. Bear with me. I gotta find which link is gonna be most appropriate to find out more about how this whole thing works. We're gonna be launching this like officially in a very simple way, I think next week, so that we can start talking about this more and more. If you have any questions, you can reach out to me. We could always schedule a demo call. We could show you behind the scenes. What I'll do is link, as I'm thinking about this, a 20-minute recorded demo that we did with a doctor, telling them how the process works, and it kind of shows a little bit of a behind the scenes on all the training. So I'll link that below and you can check that out. But if you have any comments or questions, please say that here. I can't see them right now because the camera here is turned around, but I'm gonna flip it around and I'll reply. And so have a great day. We'll talk to you soon. See ya.